Hello, my name's Adrian Richards. I'm a plastic surgeon and the clinical lead of Aurora Clinics, which is based here in the United Kingdom. In a previous video, I've talked a little bit about tuberous breasts, how you know whether you've got them, and a little bit about how they can be treated. In this video, I'm going to go a little bit more into the detail of actually what can be done. So the first thing about tuberous breasts is there's really two problems to them. Number one is the base of the breast is constricted. The fold underneath the breast may be a little bit too high, and the base of the breast from sideways proportion is quite tight. So that what produces the sort of elongated appearance to the breast. So what we're going to need to do is stretch out the base of the breast with an implant, which may be a normal implant or what we call a tissue expander. And a tissue expander is essentially an inflatable implant. So it's an implant that we inject salt water into over a period of time, and it slowly stretches the tissue. So we're going to stretch the base of the breast by a combination of releasing any tethering of the breast from inside and also stretching the base of the breast with either the implant or the tissue expander. So that's how we're going to deal with the volume changes. The next thing we need to consider is, do you need any surgery around your areola or to the nipple area? And this would normally involve tightening up, removing skin from around the areola. Often the areola, which is the brown area around the nipple, is a little bit wider and more domed. So what we need to do is remove some of it, remove some of the excess skin, and really sort of tighten that areola up, which prevents it being so elongated and pulls it in a little bit more. So in summary, treatment of tubular breast varies from person to person so much, and from side to side so much. If you've got a little bit of constriction at the base, and the nipples are in a normal position and look relatively normal, or just a little bit asymmetrical, often a breast implant alone is going to be enough, because a breast implant alone is going to lower the fold naturally under your breast, and with gravity is going to stretch that lower skin. So I've got some really good results, which you'll be able to see in the videos and the photographs, of patients who just simply had a breast enlargement, lowering the fold, and that implant is enough to stretch the base and stretch that lower part of the skin. So maybe that's all you need, just to improve symmetry, give you slightly more volume, is a breast implant. In more severe cases, with more constriction and perhaps slightly more tubular breasts, with more doming of the areola, you may need a tissue expander, which is going to gradually stretch that base of the skin, combined with a nipple procedure to tighten up the skin. So the combination of a tissue expander to enlarge the base and to tighten up the skin going to give you a really pleasing change to the volume and the shape of your bust. And now the scarring, if you simply have an implant, the scar will normally be in the fold underneath the breast, normally about 4.5 to 5 centimetres long. And for more information about breast implants, please look at our other videos, and you can actually see videos of me performing the operation if you are not too squeamish. If you do need surgery around your nipple, and this is going to involve a scar left around your nipple, because we're going to need to reduce the size of the areola, tighten up the skin, which will leave a fine scar around the nipple. So again, the options really vary according to each individual, as everyone is so different, but they essentially include an implant, be it a tissue expander or just an implant which is not expanded, to stretch the base, increase the volume, internal release of any constriction, which you won't notice, the surgeon will do that from inside, and then any surgery to correct the skin around the nipple and areola and tighten it up.